The information and tips on this show is not intended as a substitute for personal medical advice. Before making any decision regarding your health, please consult a physician or other qualified healthcare practitioner.
Hello and welcome to African American Health Matters. Well, African American Health Matters is a new mobile health text message and multimedia outreach that gives health tips and reminders to our subscribers right over their cell phones.
Yes, it actually gives them their health tips for things like remembering to take your medication, tips on handling diabetes, hypertension, losing weight, and also breaking all those bad habits.
Now, you can register online and get health text messages on your cell phone by going to www.africanamericanhealthmatters.com, or you can call our 800 number, which is 1-800-677-8441. That's 1-800-677-8441, and somebody will get back to you probably within 24 hours to get you registered.
Now, you know, African American Health Matters kicked off a little over a year ago as part of the National Physician and Family Referral Project. It's known as NPFR, and it is a division of 50 Hoops. Well, there are critical numbers of African Americans dying from prostate, breast, lung, and colon cancer, but a lot of times it's treated too late. Now, even more African Americans are affected by diabetes, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we're still needing continuing education and more information about HIV and AIDS. Our surveys show that we need more ways to access resources available in our community.
Yes, and Papa, do you know what? There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. What we need to do is educate more people about the importance of clinical trials.
I agree completely. And the only way to do this is to participate in new drug discoveries. Now, Ed, you know, racial disparities in healthcare for African Americans and other minorities, including underserved, is very high. And that's why we're so happy to have great partners within our African American Health Matters.
You're absolutely right. And each week we want to recognize and thank all of them.
Each week, we bring you tips from our African American Health Matters text message service. So here's some for this week. Here's a tip on metabolic syndrome. Metabolic syndrome is a condition characterized by elevated glucose levels, high triglycerides, low HDL, cholesterol, high blood pressure, and obesity. This comes from Johns Hopkins HealthLetters.com.
Here's one on hypertension. Recent research suggests reducing salt can save lives and may lower blood pressure as effectively as an increasing medication.
Arthritis. Here's one on arthritis tips. Get enough sleep. Focus on the good. Stand up straight. Keep a journal. Conservative footwear. Watch your carbs and alcohol. This comes from our favorite ezinearticles.com.
Heart and young athletes. HCM is the leading cause of sudden cardiac death under 50. Learn the signs and symptoms. This comes from www.4hcm.org.
Here's another video and cool tool from medlineplus.com.
Allergens like pollen are nothing more than foreign plant antigens. When they get released into the air, you can see and hear the result. As part of the body's non-specific immune defense, the stimulus for sneezing gets triggered when allergens first enter the nasal tissue. Pollen allergens encounter the plasma cells in the nose, which respond by producing antibodies. These antibodies attach to mast cells, which are white blood cells containing the chemical histamine. As more antibodies are produced, they cause the mast cells to release histamine. Histamine then produces allergy symptoms. A stuffy and runny nose, sneezing, and watery eyes help to remove the invading pollen. Medications called antihistamines may be used to help alleviate severe allergy symptoms.
Pat Sanders, how are you today?
Good, how you guys?
Dr. Whitfield, you are board certified family physician with a certificate of added qualification. I guess you call that a CAQ in sports medicine. You've attended Meharry Medical College in Nashville and earned your sports certification from Ohio State University. Being an ambassador and a national spokesperson for the American Heart Association, this is pretty much wonderful, and this is one of the reasons that we wanted to talk with you today. So we have some questions on heart and stroke in African Americans. Yeah. Well, my mother passed suddenly of a stroke and then an aneurysm, and needless to say, no one wants that experience because she was an extremely active woman, and it was just quite a shock to the whole country because she was quite active around the country. Can you tell us what are some of the signs of a stroke? What should we look for, even the most minor signs? What would you say?
That's a really good question. I had a 32-year-old African-American woman in my practice last week that suffered a stroke.
Oh, wow.
And the only sign that she had was a sudden severe headache that she never had before.
Yeah.
But that is one of the causes, sudden severe headache of no known cause. If you have a sudden numbness, weakness, or tingling of the face, arm, or leg, especially if it's on one side of the body, sudden confusion, trouble speaking, sudden trouble understanding, sudden trouble seeing in one or both eyes, especially if you have a sudden loss of vision and then it comes back. That could be determined something old school called a mini stroke. We call it a transient ischemic attack, or a TIA. And also sudden trouble walking, dizziness, loss of balance or coordination. Things that come on suddenly without any warning, and even if they resolve, those can be potential warning signs of a heart attack or stroke, and you must call 911 right away or get yourself to the hospital or the doctor's office right away. I have the 3 R's: respond rapidly, reduce your risk, and so if you see these signs, you have to respond rapidly by calling 911.
I think that's very, very good.
Tell us a little bit about your barbershop initiative.
That sounds interesting.
I'd like to hear a little bit more about that.
Well, I have a barber here in Baton Rouge, Nissan Ballard, who over the course of maybe 3 months referred about 20 patients to me, mostly African-American men, but there were a mix of patients, some women and some white Americans as well. And I called him, was like, he's my patient as well, his mother's my patient. They are from New Orleans, lost everything in Hurricane Katrina, headed to New Orleans. And I said, Nissan, what's going on, man? How you get these patients to come? He's like, Rani, these guys are sitting in my chair complaining about all these L's and L issues. And I was like, when is the last time you've seen a doctor? And there were guys that hadn't seen a doctor in 5, sometimes 10 years that had health insurance, which of course President Obama fought so hard to get this universal health care for us. He's still fighting.
Yeah, still fighting.
So he said, if you're my patient, my client, you need to go see my doctor. And so Bill Relaford out in California has been doing some screenings across the country. He's the first guy that I really attribute to doing.
Yeah, we heard about him. Yeah.
Great program. Where we're doing ours just a tad bit different from Mr. Relaford. We're not able to get the scope, so it's just a local campaign. And my barber and I go to local salons and barbershops and do talks, and he talks to the barbers and stylists about his personal mission to get his clients to go to the doctor. And then I talk about the risk factors and health issues, and then we talk about our relationship and how that's important that the barber be just as informed and healthy as the doctor. These guys used to be doctors, the red, white, and blue on the barber shop.
Yeah, that's true.
Right.
Yeah.
They are pillars in the community, just like the church is a very important figure in our community. So are the barbershops.
That's right.
So we've got to, engage those guys as well and use the community as a resource to help us get individuals to go to the doctor. So that's kind of how it started, and it's actually growing. We're going to be traveling around the country talking to different stylists and barbers about how they can be effective in getting their clients to go to the doctor. And it's not about my practice growing or him getting more clients, but it's about us educating those that are already in the field to get more individuals to get screened.
Very good.
Yeah, that was my question, because I was hoping that it would be, you have such a national and international reputation. I was hoping that there would be some way, and I think that barbershop, and we have talked about Bill Relaford.
Oh, yeah, he's great.
He is fantastic at the Barbershop Initiative. This is wonderful. I saw on a website, what was it? What website is this? You have 5 lifestyle changes for hip-hop dads. I'm looking at them. The first one is finding more time for your kids. Elaborate a little on that, because I know you personally are involved.
Yeah, I have a beautiful 5-year-old daughter. We spent the whole day yesterday at the fair, and I just think it's so important.
Yeah.
Whether you're a single father, or you're in the home with the mother, that you continue to be a role model for your children.
Mm-hmm.
And they say a village, takes a village to raise a child. I'm a proponent of that.
I am
but
too.
I also think it's so important, especially as a male, and I have a daughter, to be involved in my daughter's life, but also as if it was a son, the same thing.
Yes.
To foster these relationships, to teach them how to be young men and young women. I do a real men read, and I was honored to be able to read to my daughter's school twice this last month.
Oh, good.
So she could see her father doing the things that I hope that she would do one day, contributing and giving back to society.
You're a good daddy.
So, yeah, just being involved in these children's lives is so important. It's not about the gifts and the money that we spend on them, but it's the quality of time that I think is more important. And I've just seen it in my own child. It's just amazing to watch her grow and her to mimic some of the things that I do, and to be interested in. I bring her to all the events. I brought her to the Start Heart Walk that we did this weekend. She goes to a lot of my talks, and I don't know if she really understands what Daddy's doing, but she knows Daddy's doing something.
She knows. Yeah, she does.
Yeah, so it's just important that we have that quality time and become role models to these young people at an early age, and even those that don't have the parents in their lives. I mean, again, it takes a village to raise these children.
That's right.
I'm involved in mentorship. I have kids that rotate through my practice that want to be doctors. I try to hook those that don't want to be family practice doctors up with the specialty that they want to get involved in. So
All
I
right.
think that it's important to give back. It's fun. To me, it's very selfish and self-rewarding.
It
I
is.
feel good about helping. And hopefully other parents, and especially our African-American men, would feel the same way about trying to help these young people achieve and reach their goals.
And you made a very profound statement, Doctor. You said, exercising with your family, with all the health disparities that we see in African-American men and women, I want to be around to see my daughter grow up and graduate.
That's
right.
That's important. Exercising with your family. I think there are a lot of obese families sometimes. I think we need to be aware that just getting out and walking around the block could be a big help.
It's key. It's important. We're doing a weight loss competition here in Baton Rouge for 3 families. 2 of those African-American families, all obese. The daughter is 12, and she's 216, 218 pounds.
Oh, wow.
The
Bless
father
her
weighs
heart.
well over 350, and the mother is about 250.
Oh, boy.
And so they're participating in this program together, and I can just see
Good.
what the mother and father said to me is that we want to be around to see our daughter graduate, and they felt so bad because they felt responsible for their daughter's obesity and weight gain. She was being picked on at school, and so my heart just reached out to them.
I know it did.
I know a lot of people say, well, it's their fault, they probably didn't feed right, but there was also a lack of awareness and education in this particular family as well, and so now they know what they can do. They're excited about being in the program, and the way this program is being sponsored by the local valleys. They've got free personal
Oh,
trainers,
good.
6 months, free access to the gym. I did their free medical examinations, blood work, everything at the office that was donated to the clients.
Wonderful.
We're trying to really give them some incentives to get healthy and to change their lives. Not just 6 months. This is a lifestyle change. We want to make this impactful so these people can do better over time. So definitely walking with the family is a time for bonding, a time for exercise, and again, showing your kids what, I'm not just preaching it to you guys. We're walking this walk.
Walking the walk, talking the talk.
African American males die more frequently from sudden cardiac arrest due to hypertrophic cardiomyopathy, or HCM, than any other demographic. There are warning signs, and there are steps that you can take to protect these young lives. Learn more about hypertrophic cardiomyopathy and sudden death in the young at 4hcm.org, which is the number 4hcm.org. Take care of those young lives. They've got promising futures ahead.
When you have advanced prostate cancer, you're fighting for your life. But do you wonder if radiation therapy is enough to win the battle? Researchers are exploring an investigational agent intended to turn on your immune system, which may allow it to attack and kill cancer cells. If you have advanced prostate cancer and would like to be part of a research study investigating this treatment, call 877-547-8839 or visit www.clinicaltrialspotlight.com.
Dr. Joe Webster is an MD and founder of the Comprehensive Center for Digestive and Nutritional Disorders, and he built the Imhotep Health and Video Complex, LLC, that houses the Webster Surgical Center in Tallahassee, Florida. He's going to talk about acid reflux and gastrointestinal diseases in African Americans.
Let's get started. We want to talk about, and by the way, this is a very personal topic for us because Ed has GERD, and and so let's just talk about what it is and how it gets started and what causes it. Just start talking.
Well, GERD is, first of all, let's see what those letters mean. It's gastroesophageal reflux disease.
Okay.
Most lay people call it heartburn.
Okay.
And the thing that causes the reflux or allows it to take place is an incompetent sphincter mechanism at the lower part of the esophagus.
Mm-hmm.
Does not close properly, therefore whatever is in the stomach can reflux back up into the esophagus.
Mm-hmm.
So the mechanism is an incompetent valve.
Mm-hmm.
Everything that comes down the esophagus should go in one direction, and when it isn't working properly, then it goes backwards and we have GERD.
Okay. Now, acid reflux and GERD, is that the same thing or does one result in the other?
It is more like one results in the other. You can have reflux and the contents of the stomach may or may not be too acidic. GERD simply means reflux of whatever is in the stomach back up into the esophagus. Most people think they're synonymous, but they're actually not. So medications that we use to treat reflux disease are antacids primarily. So they only neutralize the acid. They do not prevent reflux. And that's something that most people do not understand. So you can get the acid relief, but you can still reflux liquid contents back up into the esophagus and or into the lungs and aspirate it and get asthma attacks.
So, doctor, is there anything on the market now that actually prevents that?
There's not any real medicine that will prevent reflux. There was a medicine on the market, and it has a black box warning now, Reglan, metoclopramide, that would reduce reflux because it was a motility agent. It promoted movement of the gastric contents in the proper direction. But it did not stop it completely. But that medicine now has a black box warning and you can't really take it anymore. So most of the medications on the market simply treat the acid component of reflux, and they do not treat, for example, a compound called bile. Bile is a compound that's made in the liver that you cannot live without, but it should stay in the small intestine. And when it comes backwards into the esophagus, into the stomach, it can be very damaging. So acids do not treat that at all. So there's nothing on the market medically that can treat or prevent reflux. There are surgical approaches that can correct the problem. Okay.
Now, is it also true that an endoscopy is the only true test on the market to check for esophagus?
Well, an endoscopy is the gold standard for looking at how badly the esophagus may be damaged by the reflux. That would not be our first line of investigation.
Okay.
GERD symptomatology, heartburn, belching after eating certain kind of foods, spicy foods, aggravated at times by things as simple as peppermint or chocolate.
Peppermint or chocolate?
Chocolate.
Interesting.
Tomatoes. All of those things can aggravate GERD because they either promote reflux or they promote the acidic component of the reflux and make it worse. For example, peppermint relaxes the sphincter and allows the whatever's in the stomach to come backwards. That's one of the reasons people do after dinner mints, because mints allow you to belch. And but when it opens that hole, it stays open for a long time. So not only does the air come up, but also the acid can come up.
Oh, Oh, okay. Now, coughing is another symptom. I know that, right here, if it's a lot of coughing, we didn't think about getting an endoscopy. Is that the way you pronounce it? Endoscopy.
The coughing is very interesting. Go ahead.
And it just continued on, especially after he eats something, and it's just cough, 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 and that to me was a signal that there was something, there had to be some reflux or something going on, and it just continued to get worse and worse. And then when they took the scope and they looked, you could see like an open sore. It looked like just an open sore right at the base of the esophagus and the top of the stomach.
Yes, that means he has at least grade 3 reflux with ulcerations at the end of the esophagus.
Okay.
Now, the coughing part is very interesting because that means we call that supraesophageal. I mean, that's at the very opening of the esophagus in the back of the throat. Wherever in the stomach that comes up, it irritates the back of the throat, and therefore the vocal cords, and or can get down into the lungs. So it's that part of reflux that aggravates asthma. In little children, it can cause bad dental problems in little children.
Oh.
Yeah, because you just think about it. When the child is lying flat, or the adult, the gastric contents can run up into the back of the throat, and they just sit there, irritate the back of the throat, and or go down into the lungs and cause lung disease.
Oh, wow.
Reflux is associated with asthma.
Now, Doctor, you mentioned grade 3. How many grades are there? It's the first I've heard of that. How many grades are there?
Well, typically we grade it on 4 grades and or A, B, C, D. And the Los Angeles system uses the letters, and then there's a numerical system that the rest of the country uses.
That sounds like LA too.
The severity, and so grade A being the least severe, grade 1 are A, and then grade 4 are grade D, being the most severe with ulceration and what we call stricture. So once the ulcer is there for a while, and the ulcer begins to heal, it heals by contraction. So as it contracts, then it closes off the lower part of the esophagus. So one of the damages, long-term consequences, can be a narrowing of the esophagus or a stricture, and the more dreaded long-term complication can actually be cancer of the esophagus.
Okay. Is it recommended that a person that has this, has gotten the endoscopy and they have shown this ulcer, that they get this checked frequently?
Definitely. They should be followed what we call to healing. There should be re-endoscope somewhere within a reasonable time frame to make sure that it heals up.
Okay.
Unfortunately, it's not a one-to-one relationship between the sore and what one feels. Quite often a person can have very bad-looking esophagus and may not have much in terms of what they would call heartburn.
Oh.
Now, on the other hand, people can have terrible heartburn, and when we look with the instrument, they at least at that point do not have sores at that point.
Okay.
And so it's not a one-to-one relationship between what you feel and what you get.
Okay. Now, you mentioned something earlier about position. In our African American Health Matters mobile text message service that we send out every month, one of the messages that we sent is, do not lie down right after you have eaten. So I'm presuming posture does affect acid reflux.
Posture affects acid reflux, and it's important that the patients, that our listeners take that advice. But again, it's not just the burning of the esophagus. As we said, it can affect breathing, asthma, people that have hypoventilation syndrome. Quite often, people who are obese also have reflux. That's a predisposing factor to refluxing is obesity.
I see.
It is also a predisposing factor to sleep hypoventilation syndrome. And those two things compound each other. So if you're lying down flat, getting reflux, and getting an asthma attack, and you already have hypoventilation syndrome, you get compounding matters. So proper sleeping habits are definitely important.
So choosing a right pillow that maybe elevates your neck and head above your body, would that be one of the solutions to help?
it would be preferable to elevate the entire bed if possible.
Okay.
Or get a wedge. There's a wedge phenomenon that you can put between the two mattresses or the mattress and the box spring ever, and lift the entire torso from the waist up needs to be lifted, not just the neck.
Like a hospital bed?
Yes.
Okay.
That's right.
Now, I read several weeks ago, Doctor, that prolonged use of acid reflux medications can cause stomach or throat cancer. Is there a lot of truth in that?
Well, I think that I would like to check. The problem with acid reflux medicine. Now, there's one, and I thought you were going to address that, and I'll get back to that in a moment.
Yeah, dude.
The most potent kinds of medicine to treat acid are the PPI, the proton pump inhibitor medication. And they have been associated with osteoporosis and weakening of the bones.
Oh.
Because there's an effect that the acid inhibiting medicine has on bone metabolism. But that's a very, I shouldn't say weak association, it is a weak association, and it's much more of an issue for a person not to get their acid treated properly and get esophageal cancer.
Lesser of two evils then, huh?
Right, from long-standing reflux can lead to esophageal cancer.
Think you're addicted to food? You may be right. Researchers from Yale University wanted to know if some people's brains react differently to food, the way substance abusers' brains react to drugs. First, they asked 48 young women to answer a questionnaire to determine if they had symptoms of addictive-like eating behavior. Then, they hooked the women up to a machine that measured their brain activity while they tasted either a chocolate milkshake or a liquid with no flavor. Women who scored higher on the food addiction quiz had more activity in certain regions of their brain when they were expecting food. These regions play a role in urging us to eat and are the same parts that motivate people with substance dependence to use drugs. People with higher food addiction scores also had less activity in certain areas that help put on the brakes after a tasty treat. According to the researchers, food advertising could make it hard for some people to stick to a healthy eating plan because of the way their brains respond to the ads. I'm Dr. Cindy Haynes of Health Day TV with the news that doctors are reading, health news that matters to you.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com, or you can call at 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
We want to thank our physicians, speakers, and guests for joining us on Cyberstation USA, and we want to thank Cyberstation USA for their support and vision for African American health matters on Cyberstation USA. Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyberstation USA.